ACT. Megan Holichek, Courtney Wilson, Molly Lamb, Ken Brandt, and Maria Yukin. The purpose of the current study was to further investigate the efficacy of lessons of acceptance and commitment for children with autism and emotional challenges. The current study's purpose was to investigate the efficacy of ACT in increasing psychological flexibility after a treatment package of 12 lessons from the book. 2 lessons, activity days per component of the Hexaflex from ACT were implemented to a group of children. In order to demonstrate the increase in psychological flexibility, the AAQ-II was presented as a pre- and post-test. Introduction. Contextual behavioral science has the goal of developing a science that is more adequate to the human condition. Thus, contextual behavioral science puts a larger focus on verbal behavior and cognition than traditional behavior analysis. Acceptance and commitment therapy, also known as ACT, is a treatment that is used to promote psychological flexibility in the way individuals interact with their private verbal behaviors. Components of ACT are based on relational frame theory. Emotional avoidance is the term used to refer to problematic interactions with private verbal behaviors and can be defined as rule-governed behavior. Through training, present moment awareness, acceptance, diffusion, labeling of values, committed actions, and self as context, ACT aims to increase individuals' experiences with the natural contingencies and contexts rather than solely rule-governed behavior. In order to provide a measure for the efficacy of ACT as an intervention, the Acceptance and Action Questionnaire 2, also known as the AAQ, was developed to measure the constructs of acceptance, experimental avoidance, and psychological inflexibility. Participants. ACT was run with 3 different experimenters on 5 children. The ages of the 5 children were 4 to 9 years old. Children were all neurotypical and all males. There was 1 4-year-old, 1 5-year-old, 2 7-year-olds, and 1 9-year-old. There were 4 Caucasian and 1 Mexican American. Settings and materials. 3 sessions were conducted in 3 different settings. The first session was conducted in a house located in Normal, Illinois. The participant entered the room and sat at the kitchen table. The experimenter and participant were the only ones present. All 4 windows were covered with blinds and the noise level was very quiet except for cars passing by. 1 program was performed in the adjacent living room when they needed more space to perform the activity. A session was conducted at the dining room table in Bloomington, Indiana. No distractions were present during the experiment. Only the experimenter and the child were present. The experimenter was located across from the child throughout the experiment. The other 3 participants were located in Lake in the Hills, Illinois. They were all 3 playing outside, were taken inside one by one and presented with the programs individually without any distractions inside the home. The experiment was conducted in the dining area. On a table, the experimenter was sitting across from the subject. Materials used for the experiment were the Acceptance and Commitment Therapy book by Mark Dixon. Additionally, a variety of materials were used to run the 12 different programs. These items included consent forms, wasabi beans, handful of candy, 4 different candles, a blindfold, a pen, 2 printed AAQ assessments, and paper copies of pages 39 to 40, 47 to 48, 69 to 70, through 338 from the ACT book. An iPad was used to record experiments, and a MacBook Pro was used to document the data. Procedure. After a consent was signed by the parent or guardians of each child, the AAQ assessment was given before and after ACT sessions were conducted. The experimenter read the questions aloud for the child and were given instructions to circle the number that best described their answers. Following AAQ, each child was presented with 12 ACT programs that were selected from Mark Dixon's book. Each program was presented one at a time until all 12 were completed. 2 programs were selected from each component of the Hexaflex. The programs were days 2, 6, 17, 21, 25, 31, 34, 40, 49, 50, 85, and 151. Each program started with the experimenter reading the directions aloud from the top of the page. There were 3 different columns on the program for different age groups. The experimenter presented the activity from the K to 4 age group. The child completed the worksheet. Immediately after the completion of each sheet, the experimenter conducted a debrief session with the child. Results and discussion. Overall, the results of the current study show that the treatment package of lessons from acceptance and commitment for children with autism and emotional challenges was effective in increasing psychological flexibility in all participants of the current study. Participant 1 scored an 18 on the pre-AAQ and a 10 on the post-AAQ. Participant 2 scored a 14 on the pre-AAQ and 11 on the post-AAQ. Participant 3 scored a 21 on the pre-AAQ and an 18 on the post-AAQ. Participant 4 scored a 15 on the pre-AAQ and 11 on the post-AAQ. Participant 5 scored a 13 on the pre-AAQ and a 10 in the post-AAQ. While the results demonstrate a treatment package as being effective, there were multiple limitations in the current study. All participants were neurotypical. They were all only boys, and they only used the first section of K through 4. Due to the range of locations used in the current study, inter-observer agreement and procedure fidelity were not collected for the current study, as there was only the experimenter present in each location. Also, it is unknown whether the treatment package or simply spending time with the individual talking about private events was effective in the change of psychological flexibility. To study this further, future studies should also have a control group for comparison. The current study was also limited in the diversity of participants. Future studies could investigate the efficacy of this treatment package across a wider range of age groups, a wider range of ability levels, and with children diagnosed with various mental illnesses. Another limitation of the current study was that the study was conducted in a short period of time across only a few days. Future studies should investigate the effects of treatment packages of various days in length and treatment packages that consist of various numbers of lessons. It should also include both sexes of participants and extend the age range.